we really have been able to incorporate what's meaningful for the patient and what their lifestyle entails in order to fine-tune whatever treatment may work best for them. So for instance, as Amber always talks about her farmer patients that, may live in rural communities, and it is a real challenge for them to come to the clinics often for visits. Having a BTK inhibitor therapy as an option allows them to get great CLL treatment, but not burden them in terms of the visit schedule. On the flip side, we have a lot of these younger patients coming to us now, not just the 70-year-olds, but the 30, the 40-year-olds that need CLL treatment. And those patients really often value time off treatment because they know that they have a long CLL treatment journey ahead of them. And so I think being able to offer them venetoclax and obinutuzumab and offer that 1-year finite duration treatment is really appealing to them and allows them to see returning to their lives as normal as possible. What else do you think, Amber?
Yeah, so I think a lot about, in addition to what you've said, the disease characteristics and the importance of prognostication in these folks. So things like FISH testing. Do they have something like deletion 17p, TP53 mutation testing, or even the IGHV mutation status? We know that folks who get time-limited venetoclax-based regimens do have a shorter PFS if they have some of those higher risk features, whether it's the deletion 17p, TP53, unmutated IGHV, or even complex karyotype. So I think it's really important that we just keep that in mind with these patients. You don't see that as much with the continuous BTK inhibitor therapy. The other thing that's important is thinking about, just because it's a shorter PFS doesn't mean that it's not necessarily a treatment regimen that you can use in those patients. So just because somebody has a deletion 17p, a TP53 mutation, that's not to say that you can't use a venetoclax-based regimen if that's what makes the most sense for the patient, but you would expect a shorter progression-free survival. I think cost is another factor that comes up, right? Certainly there's going to be differences in cost in an indefinite therapy versus a time-limited therapy. I'm hopeful that there can continue to be partnership with different patient advocacy organizations, pharmaceutical companies to really help patients get the medications that they need, because otherwise it can be really cost prohibitive for many, many folks who, with CLL being of an older age, retirement age, are often on a limited income and a fixed income. So I think these are key factors that I would think about in people with CLL.